So next up with us, we have a specialist from MSU Medical Centre. Her name is Dr. Faridah, and she will be telling us on how to be mentally tough and manage stress in the workplace. So can we please welcome Dr. Faridah to speak? You guys can give some reactions in the chat box, maybe some energy, like chat box. Yeah, I see some clapping emotions. All right, so Dr. Faridah, the floor is yours.
All right. Thank you, Ms. Chairperson, and hello everyone. A very good afternoon to all. I hope you can hear me and see my slides.
Can.
Okay, great. So this topic given to me is on mental toughness and stress management in the workplace. All right. So I'm going to go through these two topics, but I just want to say that my slides are a mixture of Malay and English. So is that okay if I present as Malay and English as well?
Yep, that would be great.
All right, sure. Okay. So the content of our presentation. So first of all, I will be talking about stress, what is actually stress, and then we're going to learn about stressor. Yeah, what is stressor? What is stress? What is stressor? And then I will actually invite all of you to evaluate yourself. Am I under stress? There's a way to evaluate our stress level. And then I will discuss on why managing stress is so important, why we cannot sweep it under the carpet, right? And number 5 will be some tips, yeah, DIY, something that you can do at home, or DIY tips on how to manage stress, all right? And then in the end, only I will actually clarify about what is mental toughness. Okay, so there we have a few, quite a few topics around this issue. Okay, first of all, what is stress? Okay, stress is so important that actually there is an institute on it. Yeah, an institute specifically on stress. So according to this institute, stress is actually not a useful term for scientists, because scientists are very objective. They want something that they can measure with numbers, right? But stress is exactly opposite to that. It is such a highly subjective phenomenon that actually defies definition, right? So the term stress that is currently used was actually defined by this person, yeah, who defined it as a non-specific response of the body to any demand of change. Meaning what? Meaning stress is actually our own body response. It's not the thing that actually making us stress. It's actually what within us. So it is a body response. Okay. So this person actually did a study on how stress affect the body system. Yeah. So the study was actually on animals. There's a few of course, they will use the TICOS animal model. So they put these TICOS, the rats, under stress. So what kind of stress? Yeah, the rat was so comfortable living happily, and they will give some maternal stressor, yeah, like maybe separated by from the siblings, and then give some shock, all right, and then abrupt temperature change, suddenly hot, suddenly cold, just like us, we don't like sudden change, right? And then they will give also loud noise to this animal, to the rat. And what happened to the rats? The rats developed stomach ulcer. The rat developed shrinkage of the lymphoid tissue. What is lymphoid tissue? Lymphoid tissue is a tissue in the body that actually secrete our defense mechanism against infection. Okay, so it makes this tissue become shrinkage. It seems like it is not working properly. And then also it leads to enlargement of the adrenals. Adrenals, what is adrenal? Adrenal is the gland in our body that produces stress hormones. So the stress hormone gland seems to be working so hard, but the gland which is producing our body defense mechanism become very shrunk, and is not functioning properly, right? So eventually, when they look at this rat, continuous stress, these rats develop heart attack, stroke, and kidney disease. Okay. So my presentation is I want to share about on the KKM module, our Kementerian Kesihatan Malaysia module, on from the unit Kesihatan Mental on stress, because they actually summarize what stress is all about. to the contact is our own population, and the DIY part is very something that we can use in our daily practice, right? So from this model, it says that stress ialah, is actually the tekanan or the pressure that an individual feels because of what happens around them. So anything happen around them, what they feel inside. Okay. So what is this thing? What is the thing that actually can trigger this feeling? Is actually whatever that person regard as mengancam ataupun threatening their well-being. Yeah. If we think that whatever happening around us is not threatening to us, it will not be a stress. Okay. When we feel that it is threatening to us, then it will become a stress. Right. So yang dianggap mengancam atau dianggap mengganggu keadaan diri seseorang. Kalau kita rasa macam the stress is there, stress tak ada benda ni, it doesn't bother me, so it will not become a stress. Right. So stress ni dia boleh berlaku dari segi emotion and also physical. So the effect can be emotional effect and also physical effect. Right? And it is something that sering berlaku. How many times in a day will we say the word stress on a normal working days? So many times, right? Stress lah, sikit-sikit stress. What does it mean? Right? So it is something yang sering sangat berlaku dan dia merupakan cabaran emosi. It's all about inside, the emotion. Yeah? Right, the CDC, the Centers of Disease Control and Prevention, define stress into, stress is actually, they say, is the result of pressure or tension, yeah, whatever pressure or tension, and how our body responds. See the keywords there? Result of and how the body responds. So if we do not regard the thing as a stress, as a stressor, it is not a stress. Right? So is stress always bad? It is not. Because we need some stress in our life to push us to perform the best, right? Okay, so if you look at this figure, graph, it shows the relationship between the pressure and level of stress on the x-axis from weak to strong, and then the y-axis then from weak to strong on our ability to cope and our performance. It doesn't matter what kind of performance, at school or at work. Yeah, so it seems like, can you see the shape of the dome there? So it is actually a dome-shaped relationship, and it shows that the optimum peak performance actually happen when there is like an intermediate or mid-level of pressure and level of stress, not when the pressure and level of stress is low, right? So when at this level, when there is an optimal stress, it's actually push us to perform the best. It will make us alert, decisive, creative, stimulated, high energy, focused, and work feels effortless. Right? As compared from like when there is no pressure, no pressure, nothing is triggering me, that person can be bored, and poor morale, no motivation, frustrated, However, when the stress becomes prolonged, the stress it can reach into this overload level of stress, right? So this overload level of stress is actually not good. It will lead to deterioration and health breakdown and also burnout. So this is not good. This is what happens when somebody is under chronic stress. There's a reduced efficiency in activity, low self-esteem, can easily get irritable, anxious and exhausted somehow. Not good. So the best is actually when there is an optimal level of stress. All right. So basically, the types of stress, there are two, either acute or chronic, right? So acute stress, when the stressor is in front of us, it can either be a positive stress, something that actually pushing us to perform our best, or it can also be a negative episodic stress, meaning that person when there is one stressor, but that person cannot cope, right? So then it will become a negative episodic stress. But if the stress becomes repetitive and over so long, it will become toxic stress. So this is the level of stress which has a lot of complications. All right, so next we're going to learn what is stressor. What is stressor? Stressor ni sebenarnya ialah what is causing the stress. Apa itu pencetus stres? Kita kena faham untuk for us to actually manage the stress, which is the body response, we need to know what are the pencetus stress, because we have to solve the stressor. What is causing the stress? So the stressor can be divided into two, like internal and external. So what are the internal stressor? Internal stressor ni ialah apa yang orang tu ada di dalam dia lah. Kan? Stressor tu apa benda yang boleh menyebabkan dia stress. Number one is personality. I'm sure all of you have heard about A, B, C, D lah, banyak personality. I'll go through that later. But among all the personalities, jenis A atau type A yang paling senang stress. Nanti saya cerita apa dia orang type A ni. Next ialah orang yang ada negative emotion, negative thinking. This person has a more like a tendency to think negative about things that is happening around him or her. So this person dia rendah diri, dia was-was senang cemburu, hasad dengki dan senang berasa sedih macam tu. Or pemikiran negatif, the thinking is negative. Like sempit, suka memperbesarkan situasi yang simple je pun kan. Bos bagi kerja dekat orang ni, kenapa bos tak datang kat saya macam tu. Suka membesarkan situasi, okay. Or biological even, when we are actually unwell, that can be a stressor. Like having fever, but you know you have so many works to do, but then you're having fever, and then there's nobody covering you, so that can be also can be a stressor, right? Or penyakit critical, and I've seen a lot in my practice, as simple as having recently diagnosed to have diabetes. Diabetes is very common in our country, right? 40% or 30 to 40% have diabetes. That is among those who know that they have diabetes. So that is quite common, But having been diagnosed or told that we have diabetes, that can also be a stressor. Right? Okay. Luaran apa? What is around us that can be a stressor? Ni simple lah macam tikus tadi kan. Persekitaran fizikal yang kita tak suka. Gangguan bunyi atau bau atau lain-lain. Or social conflict dalam hubungan interpersonal, either dengan orang-orang yang di keliling kita. Ataupun anything, peristiwa penting yang berlaku dalam hidup kita, like getting married, is very stressful, penceraian, kematian dan lain-lain, and then like organization itu sendiri, dia punya macam mana kita regard how demanding an organization is to us. Like masa kita kena korbankan, kita rasa macam tu kan. Bebanan kerja kita macam mana, ataupun kita dah bosan dengan kerja sebab kita melakukan benda yang sama. Right. So mengikut according to this module, dia dalam banyak-banyak tadi, faktor stres yang paling common dekat kita punya society ialah nombor satu ialah jenis personality tadi. A. Next ialah pekerjaan. Kita punya work is the most common, is the biggest stressor in our society. Right? Lepas tu persekitaran kita, apa yang berlaku di sekitar kita, keinginan kita sendiri macam ni. Kita yang letak our own KPI, who are we going to be, what car we want to drive, what house we want to have, we put our own KPI ataupun keinginan, lepas tu kita stress nanti. Right? Lepas tu dalam rumah tangga juga, macam peranan atau tanggungjawab ibu bapa, how are we going to juggle between work now that everyone has gone back to work, and then children going to school again, and COVID is still out there. There's so many things that we are trying to juggle. So these are very common. These are the very common stressor, right? Next will be faktor social economy, like kemiskinan or money lah, pendapatan rendah, hubungan sosial, hubungan interpersonal with others, and also hubungan intrapersonal with ourselves. Right. Ini just an overview about the 4 personality types. Okay, cuba kita tengok kita ni personality types yang mana. Saya kata tadi, type A yang paling senang stress, right? So type A is the director. Orang-orang ni tak semestinya jadi director, dia cuma ada personality dia kan. Dia goal oriented, risk takers. But these people, type A people, they are actually good under stress. Dia senang nak sampai the optimal dome just now. They're good under stress. They perform the best. Type B is a socializer, relationship oriented. Always think about where I want to go somewhere with my friends. Dia suka berjemaah je. Dia suka do things in group. If you give them group project, they will move faster. Kalau they will do that project alone, slower. So this is type B socializer. Yeah. The type C is a thinker, detail-oriented. You give one work very logical and prepared. Take so much time. Yeah, so much time to plan. The good planner. Yeah, and the supporter is a type D. Good. It's great to have supporters as the employees because they are the task-oriented. You give them things, they will grow hands. You'll perform the best. Yeah, very stabilizing and cautious. But most of us, we are in the type X. Yeah. Combines two or more personality types when they are equal. Right, so what are the common workplace stressor? Common workplace stressor is the interpersonal conflict number one. Yeah, it's either we realize it or not, we are in conflict. Sometimes we don't realize, but it kind of happen, we feel the stress, but we don't know what it is. Right? Next will be physical discomfort. Yeah, long sitting. Yeah, this is quite common during the MCO when people were doing a WFH. So they will have a lot of problems, again, mechanical back pain and all, because they have been working for like hours and hours dekat meja makan. Yeah, instead of the actual office chair. So next is disorganization. Yeah, of course, next will be multitasking. Yeah. We only have two hands, but we are playing with more. Right. Okay, now let us evaluate ourselves. Am I under stress? Macam mana ni doktor? How do I know that I am under stress? Kan? Sebab ada setengah orang, a lot of people kan, they don't realize that they are actually under stress until they, but they do realize that they have this tanda-tanda stress. This is from the module of KKM just now. So apa tanda-tanda stress yang dia realize dalam diri dia? Physically, dia start rasa macam kering mulut dan dry mouth, start rasa gementar, ya? Sakit kepala, very common, people under stress, masalah tidur, ya? Susah nak tidur, susah nak initiate sleep. When they're trying to go to sleep, they take like hours for them to fall asleep, and once they fall asleep, they woke up in the middle of the night at 3 to 4 AM, cannot sleep anymore. Yeah? And then rasa cepat letih. You come to work, we come to work at 8 and start working at 8:30, and suddenly after 12, before noon you letih already, which is usually you are not like that. Okay, so there's something going on there, and then rasa lenguh badan, rasa macam rasa saya nak pergi spa lagi lah. I need spa appointment. Yeah, rasa jantung berdebar-debar. This is quite common presentation when people come to see a doctor. Yeah, they feel that they're aware of their heartbeat. And then sakit perut and cirit-birit also. Yeah. Psychologically, that person will realize that dia start rasa gelisah, dia rasa anxious macam tu. Dan cepat marah over very simple things, and usually before it doesn't bother her, but now very irritated by it. Yeah. Lemah semangat, rasa bimbang, ya. Kurang daya tumpuan, they cannot last long in terms of attention and concentration. The mind can easily get drifted away. Ya, and mudah lupa. Dulu memang lupa ni, mudah lupa. Ya, dulu selalunya tinggal keys je. Now like everything is tinggal. Okay, and then the feeling of failure, ya, afraid of failure, rasa rendah diri, resah dan bosan. Kalau tak rasa macam tu, tak perasan juga ni. Look at the behavior. Do we have any behavior change in us? For the smokers, maybe if for the smokers, they will feel that they will need more cigarette to calm them down. Which is not good, of course. Yeah, they would feel that they would need more cigarette to calm them down, and maybe drinking more alcohol than usual, or even taking drugs. Yeah, like sleeping tablets or even the recreational drugs. Or masalah tabiat makan. Yeah, a lot of people will blame stress when they are gaining weight. Kan, stress lah doktor, nak makan lah doktor. Yeah, or when they realize that they become aggressive. Ya, senang marah, and then ada bully punya sifat macam tu, and vandalism, destroying things. Alright, so according to the WHO, these are the common physical signs of stress. Number one is headache, most popular. Headache, neck and shoulder pain, back pain, upset stomach, not feeling hungry. Yeah, not feeling hungry. I must stress this, I will explain later. And feeling lump in the throat. Yeah, rasa macam tercekik gitu. And heavy in the chest and the tight muscles. These are the most common physical signs of stress. How about the thoughts, the thinking and the behavior? The common ones are these. Feeling that I'm weak, I don't have the power. Being hard on ourselves, judging ourselves. and then finding the life hard. It's all too hard. I cannot be a good mother. I cannot be a good employee, and then try to be a good mother and a good wife and in-laws and whatnot. Yeah, and then easily getting into arguments or fights. We feel that we can easily not agreeable to things, macam tu. Yeah, and then worrying about the future also. Yeah, over worried about the future. What's going to happen? Now COVID dah naik balik lah, macam mana ni? Nak MCO lagi boleh raya ke tak ni? Benda yang beyond our control. Right? Ada tak cara like in numbers? Of course ada in numbers, yeah. This is the Ottawa Mood Scales. Okay, let us evaluate ourselves for this particular moment. Where are we? So what is zero? Zero ialah bila kita rasa very calm on a vacation that we can afford, yeah, and calm, relax, and confident, yeah, no distress, no stress. That is zero. Number 10 is when we are completely distressed from our previous experience tadi. Bila kita rasa kita completely distressed, overwhelmed, or stressed out, that is number 10. Kita sendiri evaluate now at this particular moment, where are we? 0, 1, 2 until 10. So if our level is more than 6, 7, 8, 9, 10, meaning our stress level is high. Alright? Okay, so that is how we evaluate. Okay, so now, kita keluar daripada itu sekejap. Saya nak cerita, I want to share about why managing stress is so important. Yeah, why do we bother? Ya, semua orang stress pun. Kenapa? So kita nak belajar medik sikit kat sini, ya. Okay. So the effect of stress on your body is actually the whole body, head to toe, kind of thing, yeah, everywhere. But I'm going to highlight the important system only, right? But the effect is everywhere. Now, before I do that, I just want to go through how stress actually, what is the reaction of stress in our body. So remember from the very beginning, stress is a body response, yeah? So it is a stress response system. So what actually happened to us? So we have a stressor there, right in front of us. That is a stressor, pencetus stress. Disebabkan dia adalah body response system, it depends on how our brain interpreting this, whether this is a stressor or not. Itu sebab ada orang COVID naik, what's the problem? Ada orang COVID naik, jadi lain. Nampak tak? The stressor is the same, but the way that we are evaluating it or percepting it is different. Alright? So brain kita akan evaluate dulu. Dia evaluate, dia kata, oh benda ni stressor ni, okay, I'm going to get under stress. Yeah? So the brain can start secreting ni hormone ni, ACTH from the brain. This hormone will go to the adrenal glands, yang hormone yang tikus tadi tu. Yang tikus tadi yang the adrenal glands become enlarged, right? Working so hard. So this is the adrenal gland. It is situated just above the kidneys, right? So this adrenal gland will then stimulate the stress hormones. The stress hormones are the adrenaline and the cortisol. Okay? So this adrenaline and cortisol will then go to the rest of our body and producing effects. So what are the effects? It will go to the lungs. It will lead to dilatation of bronchioles. Bronchioles is our airways, yeah? Dilatation so that what? So that we will be able to inhale more oxygen than usual. Because the stress body response is actually preparing us to be strong, like a superwoman or superman, yeah? Like if somebody that we feel that is threatening us, chasing us, okay? So this is what happened in our body to make us powerful, right? So, and these hormones also will go to the heart. Yeah, it will increase the heart rate so that the heart will be pumping more blood into the brain, into the muscle, into the vital organs, right? And then it will also go to the liver. What does it do in the liver? It will stimulate the production of glucose. Yeah, our body will need glucose to work, to become powerful. Muscles will need glucose to become powerful. So even though we don't eat at this particular moment, the liver will automatically produce glucose, right? And then it will go to the tummy as well and decrease the digestive system activity. Okay, like macam kita ni lah, you putus cinta lah kononnya kan, kenyang lah, kan, tak ada mood, apa semua kan, berat badan boleh turun. So that is what actual stress when it's actually happening. Yes, acute stress. And then the blood pressure will also increase. Okay, so what is this preparing us for? It is actually preparing our body for fight or flight response, so that we can fight or we can run away. Yeah, they're giving us power. Okay, so when the stressor stops, stressor is not there anymore, the person chasing us has gone. So the brain will signal system to normalize. All this will normalize. So no problem. So stress is good there. But then, if the stressor continues, the person keep chasing us for a year. Imagine, yeah? And then the cycle fail to normalize. The response, all this response will continue. This is what causing chronic stress. Right. So this is a psychophysiological stress model. Okay. Perceived stimulus, perceived stressor. We perceive, and it is stressor, whether we perceive it as a stress or not. Okay. So then, if we perceive this, the stressor as a stress, it will then depend on our coping pattern and our early experience, whether we have overcome the same stress before, or our genetics. We decide whether we can control the situation, number one, or we lose control of the situation. This is the two options, right? So if our body regard it as we can control the situation, it will become the fight and flight, yeah, led primarily by the adrenaline and noradrenaline that makes us powerful. Okay. However, if our body regard this stressor or the perceived stimulus as defeat, lose of control, we cannot control this, it's a defeat, then the cortisol, the stress hormones will be released. Okay, so all the effect that we're having, the bad effect, is from the cortisol and also the adrenaline. Okay, right. Okay, so again, the systems in a human body, our human body is composed of so many systems. Yeah, so many systems. God created us like this. Okay, so human body system, there are so many, and all these systems can be affected by the hormones that I just mentioned just now. Okay, so saya nak focus on some important systems only, yeah, not all. So we'll go for the nervous system first. What is the nervous system? So the nervous system comprises of the brain, the spinal cord, and all the nerves into the periphery. Remember, people who are anxious or stressed, they can get numbness in the pins and needles and numbness, right? So basically, chronic stress will actually make somebody overeating or not eating enough. Whenever they eat, the brain will make them, very less likely to feel satisfied with whatever they're eating, right? And a lot of people also using food as comfort to relieve the stress. Okay, and chronic stress can lead to insomnia, difficulty in sleeping or sleeping problems. It can lead to alcohol or drug abuse, and it can lead to social withdrawal. Prefer not to see others. That's it. I'm stressed. I just want to go home and lock myself. Macam tu, right? So eventually, it can lead to mental illness like anxiety and depression. Okay. So how about the cardiorespiratory systems? Cardiorespiratory system ni apa? The heart, the lungs, the vessels, right? The system of the heart which is carrying the oxygen. Okay. So when somebody is under stress, remember the pathophysiologist now, the circle that I explained earlier. So when somebody is under stress, it will make that person breathe faster. So for somebody who already have breathing problem like asthma or emphysema or any kind of chronic breathing problem, then stress can make it even harder to breathe, right? And the stress will actually make what? The heart pumps faster and blood vessels to constrict. Okay, so what does it do? What is the purpose of doing this? The purpose is originally to divert more oxygen to the muscles so that we become powerful. But meanwhile, it leads to elevation of the blood pressure. So frequent or chronic stress will lead to increased blood pressure and increased risk of stroke or heart attack. Now, digestive system. What are the digestive system? From the mouth till the anus. Everything inside, like in the picture here. Right? So stress, remember I said earlier, stress will actually trigger the liver to produce extra blood sugar to give a boost of energy, which is good. But then chronic stress, how about chronic stress for months and years having the stress? Increases risk of developing type 2 diabetes. And also stress increases stomach acid production, leading to heartburn and acid reflux increased risk of gastric ulcer, existing ulcers to add up, just like the rest just now. And gastric mobility as well. It can lead to diarrhea or constipation, yeah? Nausea, vomiting, stomach ache, no specified, don't know what's going on, sometimes we get cramps, like that. Now, the musculoskeletal system. What are the musculoskeletal system? The muscles and the bones and the joints. When somebody is under stress, the muscle will tense up to protect from injury. Our muscle will be like that, ready to fight. Yeah. When the stressor is gone, then the muscle will relax. Okay, so just imagine somebody who is always like that for a year. Sepanjang MCO, almost 2 years now. Okay, macam tu. So what will happen? Constant stress, muscles may not get the chance to relax. It will lead to tight muscles, headache at the back here, back and shoulder pain and body ache. Right? How about sexuality and productive system? Stress is actually both exhausting for both body and mind. So it is not unusual to lose your desire. So chronic stress reduces male hormones, which is testosterone. So and it has its own complications. And also chronic stress interfere with females' hormones and maybe will manifest as abnormality of the menstrual cycle. It will become either irregular, heavier, or more painful. And whomever at the age of 45 and above, it can actually magnify the physical symptoms of menopause, even though they have not reached menopause. Right? The most important system now, immune system, our defense system against infection. These are the immune system, yeah? Right. So in acute stress, actually, when the stress is right in front of us, it stimulates the immune system so that we will avoid the infection and heal wounds faster. However, chronic stress weakens our immune system. It reduces our body response to foreign invaders and infection and increase the time it takes to recover from illness or injury. Right? So kita continue cerita rat tadi. Apa cerita rat ni? So rat tadi, the rats were put under stress, continuous stress, and they look at how is the immune system or immune system function of the rat. And it shows that there is a reduced response to antigens. Antigen ni apa? Antigen ni foreign body lah, virus ke, bacteria ke, there is a reduced response to antigen, right? And also reduced number of immune cells. Immune cells ni apa? Yang askar-askar lah, people keep talking about vaccine and askar and all, right? So basically, there is a reduced overall immune system function. Okay, so study ni juga dia tengok dalam manusia kan, apa benda when the stress leading to impairment of the immune system function, but like the component of stress itself, sama ada di social network, interpersonal relationship ke, ataupun external stressor ke, perubahan something outside us, or the perceived stress, misalnya yang what we feel the stress is, whether that thing is stressful or not, our perceived stress, which one has the strongest association to health? And of course, perceived stress has the strongest association to health. Not really the interpersonal relationship that is actually happening, not really the external stressor that is actually happening, but the way we perceive the stressor around us. Right? So this is a simple graph showing the association between stress and immune function. So x-axis you have the duration of the stressor, y-axis you have the immune function. So started at 100%. So at the onset and moderately prolonged, there is an increase in there is an increase of the immune function. See, onset, moderately prolonged stress, there is increase in the immune function. But then with continuous stress, there is a reduction. Reduce the immune function will reduce and reduce even lower and lower and lower. Right. So the system in the human body, there's so many, and the stress affects them all. Okay, right. Number 5, how to manage stress. So yang ni saya akan bagi DIY tips ya. So I'm using basically the KKM module of mental health tadi on what we can do at home, right? But before that, we have to understand we have to know what is the level of stress that we are in right now, because there is a certain level of stress that we need to see a doctor. So this is the first part that I want to cover, right? So first is the mental health screening, the stress. Where are we? Okay, tengok kita 7, 8, 9 or 10, meaning high level, right? Sekarang ni, as I said earlier, stress is strongly associated with what? Depression and anxiety. Kemurungan and anxiety or kerisauan melampau. So how do we know that we have reached or not this level? Because depression, you would need doctor's help. Need to be assessed by a doctor. So there is a simple questionnaire that can help us evaluate. This is a questionnaire. Only 2 questions. Okay, so in the past 2 weeks, have you been having little interest or pleasure in doing things? Macam lebih suka not doing anything. So dalam masa 2 minggu So not at all. Okay je 2 minggu dia doktor kan. Okay je macam biasa je. Adalah beberapa hari, several days doktor, I don't feel like doing anything. Or even more than half of the days. Half, maybe 7 days. Ataupun every day saya macam ni doktor. So the marker is like that. 0, 1, 2 and 3. Right? Question number 2. In the past 2 weeks, have you been feeling down, depressed or hopeless? Nangis sorang-sorang Kalau not at all, 0. Several days is 1. More than half the days 2. Nearly every day 3. Okay, sekarang you campur. Contohnya yang atas tu 2, yang bawah tu 2. 2 campur 2, 4 kan? 4. So if it is more than equal to 3, you need to see a doctor, you have a risk of depression. Alright, okay, then the doctor will evaluate you further. Doesn't mean that you have depression, but there is a risk there. Okay? Same with anxiety. In the past 2 weeks, have you been feeling nervous, anxious or on edge? Kadang-kadang kita rasa, alamak, tengok-tengok berita, alamak, COVID dah makin naik, kan? You feel like, oh, what's going to happen? Macam ni kan? Rasa macam you duduk dekat satu cliff and you are about to fall. That is how the feeling is. Okay? Kalau not at all is 0, 7 days is 1, more than half the days is 2, nearly every day is 3. Number 2, in the past 2 weeks, have you been feeling not being able to stop or control worrying? Tak nak stop, tak nak control. Ni sama juga markah dia, 0, 1, 2 and 3 and you campur. Katakanlah first tu ialah nearly everyday lah sejak nombor makin naik, mungkin beribu-ribu ni, 3 lah katanya. Tapi tak adalah rasa macam boleh control, so you dapat kosong. Right? Okay. So then, but it is still 3. So you are at risk. So when you are at risk, it is advisable to see a doctor first. Just make sure that it is not a pure anxiety. Because we have our own way to diagnose and assess and diagnose properly. Alright? But if you don't have this, mean the anxiety level and depression level is not critical, you can try this method of DIY. Alright, so kaedah menangani stres, modul kesihatan mental KKM. Okay, dia ada 2 kaedah. Satu dia panggil penyelesaian jangka pendek kaedah 10B. Yang ni yang disejak. This is a very old model actually. Dah 10 years. But I find it very, very practical. That I can advise my patient and usually people can follow. Okay, so penyelesaian jangka pendek kaedah 10B ni, dia ada bertenang, bernafas dengan dalam, berkata relax, beribadat, bercakap dengan seorang, berurut, berehat, mendengar muzik, beriadah, bersenam, berfikiran positif. When would you practice this? When the stressor is right in front of you. This is what you do. Why you do this? Because you want to break the cycle. Remember the hormone cycle just now? You want to break the cycle because the cycle is harmful. Okay, so this is what you use, the 10B. But then, takkan selama-lamanya nak break cycle je doktor. Then we have to deal with the stressor because the stressor can come again. So then there is a penyelesaian jangka panjang konsep ideal. So identify, describe, evaluate, act and learn. Kita akan go through sikit-sikit ya. Hopefully we have time for this. Sikit-sikit saja because I think it's very good and very practical. Now, penyelesaian jangka pendek kaedah 10B. Nombor 1 ialah bawa bertenang. Okay, remember lepas ni sebab ingat Dr. Faridah kata the stress is a cycle which is inside us. Okay, our task now we want to break the cycle because the cycle is harmful to us. Bila dia jadi kronik, masa dia acute, okay lah kan orang tengah kerja memang kita nak pun jadi powerful lah. So bila dia macam tu, so we want to break the cycle. Number 1 is we have to bertenang. The bertenang is for us, not for the stressor. Ini particularly important. Bila kita dah dapat kerja, contohnya benda yang buat kita stres itu adalah manusia kita tengah marah ya. Okay, so bila kita buat 10B ni, we have to believe that what we are doing is for us because yang orang tu kita belum deal lagi. Okay, so kita bertenang, cuba bertenang sekiranya anda stres. Bertenang boleh membantu mengurangkan stres dengan menghentikan kitaran stres di peringkat permulaan. 1. Number 2, how do you do it? You bernafas dengan dalam so you get a lot of oxygen going into the body. A lot. So what does it mean by dalam? 5 count in, 5 counts out. So this is bernafas yang dalam, ya. And then say to ourselves, our brain need to listen to something. Cakap, relax lah, relax lah, relax, relax, relax. Astagfirullah, relax, relax, relax. Macam tu. Ya, kita cakap supaya kita punya brain ni dengar. Okay? Beribadat, berzikir dan beribadat memberi sokongan emosi dan melegakan perasaan. Any religion will have our own routine on doing this. And it has been proven to be good. Right? And then bercakap dengan seseorang, find somebody that we can trust, ya. Well, this depends on the situation whether we would like somebody who actually will counteract our feeling or bagi fire sikit kat feeling kita. Sebab kadang-kadang bila kita tengah marah pun kita tak nak orang tu asyik nak pujuk kita, awak saya tengah marah ni, apa ni kan? Kita rasa lagi nak marah. Tak semestinya orang yang counteract kita tu akan actually padam the fire, maybe more sebab kita rasa dia tak faham kita. Okay? Somebody that we can actually ventilate our feeling. Right? And then berurut, ingat masa-masa yang jam-jam tu. Berehat dan mendengar muzik, ya, berehat sambil mendengar alunan muzik yang lembut, ya, ataupun apa muzik kita rasa entertaining. Beriadah, berkelah, berenang, daki bukit, berkemah, hobi, ya, ni antara benda yang kita buat. Contoh ya, kalau kita dekat tempat kerja, kita pergi jalan. Kita tengah stres betul-betul tu, kita ambil 5 minutes pun tak apa. Pergi jalan dulu, kita punya aim ialah untuk break the cycle. Right, bersenam. Bersenam dapat meningkatkan pengeluaran hormon endorfin dan this is the happy hormone that will counteract the cortisol, the bad hormone. Ya, apa-apa saja. And then ubahlah cara kita berfikir, berfikiran positif, always think that there's something good behind whatever is happening to us. Basically. Alright, tu 10B. Break the cycle. Next. Penyelesaian jangka pendek ni sebenarnya is a short term strategy, ya. Dengan melakukan kaedah 10B, kesan physical stress seperti denyutan jantung, laju lah, rasa marah lah, gelisah, whatnot tu semua dapat dikurangkan. And why are we doing this? For us. Ya, jangan risau. Bukan sebab kita dah maaf orang tu belum lagi, ya. Macam tu. Ya, untuk kita. Okay, so next. Sekarang kita nak deal with the problem. So penyelesaian jangka panjang konsep ideal. Apa itu I? I itu ialah kita kenal pasti masalah sebenar. Yang ni kita kena duduk diam-diam, ambil kertas tulis tulis. Apa masalah sebenarnya ni kan? Apa yang buat kita stres kat tempat kerja ni? Contoh And then D, you describe. Terang dan cari cadangan penyelesaian yang ada. Cadangan penyelesaian kita, selalunya kita boleh keluarkan sendiri, cuma kita tak tahu which one is the best. Dengan menggunakan kaedah ni, dia akan menerangkan, dia will clear up the steps that we actually know how to do. Right? And then evaluate each step tu. Contohnya kan, not happy at work, what is the problem? Number 1, number 2, number 3. Cadangan penyelesaian. 1, 2, 3, 4, 5, quit. Contohnya kan. Tu kita evaluate. Buat penilaian setiap cadangan itu. Apa kebaikan dia, apa keburukan dia. Ya? And then act. Dah buat cadangan, kita berpilih apa kita boleh buat sekarang ni. Okay, number 1, kita buat number 1 dulu penyelesaian. Kita pergi, jumpa orang tu, panggil and discuss. Kita act on it. And then we learn, it works or not. Tengok-tengok serupa je. And then we have to go to the second cadangan in the list. Macam tu. Right? So, punca tu yang bawah tu, identify tu, bila kita tengok the stressor itself ni, dia ada dua je. Sama ada benda tu we are in control of changing it or we are not in control of changing it. Okay, example COVID makin naik. Okay, adakah kita boleh mengubah dia? Us alone, like now, unlikely. Jadi benda tu kita tidak boleh ubah. Okay, so bila kita tidak boleh ubah, macam mana kita nak buat? Jadi diguna the second half, yang lower part of this diagram dia, infografik ya. Bila benda tu tidak boleh diubah, kita terima keadaan tu dan hakikat tersebut. Memberi makna yang lain kepada situasi tersebut dan mengandalkan emosi kita secara positif. Kita yang adapt to the situation when the situation cannot be changed. Kita adapt. Ingat, because stress is our own body response kan? Jadi kita yang adapt. Tapi sekiranya benda tu boleh diubah, kita guna konsep ideal. Janganlah tidak mengubahnya. Sebabnya dalam pengendalian stress management ni, kita kena deal with the stressor. Alright. So in this module also, they outline 6 important skill on stress management. What are the skills that we need to have? Number 1 ialah anger management. So module ni suggest guna traffic light. approach. Kita tengah marah, berasap ni ya, kita pun bagi red light. Bagi red light. Okay, beri ruang, bila kita bagi red light, maknanya kita bagi light kepada diri kita bukan kepada orang tu. Pada diri kita beri ruang untuk menimbangkan situasi itu. Masa red light ni kita guna yang teknik 10B tadi. Ya? Jika kita tidak dapat mengawal keadaan, tinggalkan tempat itu serta-merta. Red light. Sebabnya kita sekarang nak break our own cycle. Kemudian kuningkan dia, yellow. Kita berfikir sebelum kita bercakap dengan orang yang kita marahi, kena pasti dan cuba fikirkan cara. Timbangkan kekuatan dan kelemahan, jangan buat sesuatu yang merumitkan keadaan, fokus kepada isu sebenar. Make a step. And then we bertindak, kita act. Okay, so this is the traffic light approach of anger management. Kemahiran nombor 2 ialah berfikiran positif. This needs practice actually. Ya, bila ada benda berlaku, kita kenal pasti situasi itu, kita nilai apa kita sebenarnya ada fikiran negatif ke tak. Bila kita rasa kita ada fikiran negatif, benda tu boleh menjadi stressor yang memburukkan kita. Ya, beri kesan yang buruk pada kita. Kita nilai dan kita gantikan. It needs a lot of practice in this. Right? Kemahiran number 3, especially at workplace, is pengurusan masa. Prioritizing, make a list. Ya, make a list boleh. Kalau tiba-tiba kerja tak siap at the end of the day, kenapa? Bila kita ada plan nak cover dia balik, because pengurusan masa is so super important. Okay, kemahiran 4, kita dah go through the ideal tadi. Penyelesaian masalah dan buat keputusan. I identify apa? Boleh ubah, tak boleh ubah. Kalau tak boleh ubah, we deal our own emotion. Okay, boleh ubah and we do this. Alright. Number 5 is realization technique yang kita dah buat tadi. 5 in, 5 out. Okay, and manjakan diri kita. Rehatkan badan dan minda secukupnya. Luang masa bersama keluarga, tidur yang mencukupi. Berapa lama? 7 hingga 9 jam ya. Sepatutnya dalam literature kata. Berurut, bersantai, spice ke? Right? Ni kemahiran nombor 6. Yang agak susah tapi it is important, especially at workplace. Tegas diri and assertive. Ya, apa maksud dia? Tegas diri ni maksud dia macam ni. Kita ni can either be an assertive person or passive or aggressive. Passive ni apa? Bila orang bagi kerja je, I'll do it. Never mind, I'll do it. Ya, submissive. Aggressive ni, orang nak suruh buat kerja pun orang dah lari dulu. Ada that. Orang leave me alone or else. Actually, these two people, they are can easily be under stress, right? This is what we need. Assertive, like the skill to negotiate. Like I need time alone, how about later? Something like that. Yeah. Okay, saya nak bagi example je. Macam mana WHO outline how to cope with stress during COVID-19 outbreak. Ya. Sekarang dia become relevant again. Hari tu macam dah tak relevant. Ya. Mula-mula kita kena accept dulu. It is normal. It is not something that we can change. It is normal to feel sad, stressed, confused, scared and angry during a crisis. Ya, ini cara dia. Ini stressor dia ialah COVID-19 outbreak ya. But the DIY part is you can whatever stressor that come upon us, the same approach can be used. Number 2, have to maintain healthy lifestyle, including proper diet, sleep, exercise and social contact. Diet, sleep, exercise, social contact. Yeah. Number 3, do not use smoking, alcohol or other drugs to deal with emotion. It will make it worse. Number 6, gather information that will help you accurately determine your risk. Gather information. Knowledge is power. Jangan dengar cakap orang. Ya, dapat ni kat phone, tengok lagi kat tambah stres. Ya. And then limit worry and agitation by lessening the time you and your family spend watching or listening to media coverage that you perceive as upsetting. Ini especially true masa yang ramai sangat mereka-mereka yang kena masuk ward, ya, meninggal dan sebagainya. Okay, and then draw on skills. Buat cari yang sesuatu yang boleh menyebabkan kita fikir ataupun our concentration ke arah benda lain, ya, daripada terlalu memikirkan the stressor. Ini example dia. Okay, saya nak touch saja berapa minit je. Apa itu healthy lifestyle? Healthy lifestyle ni has only 5 keys. Tapi 5 susah nak buat. Okay? Nombor 1 ialah healthy eating. Ya, healthy eating, makanan sihat. Nombor 2 is being physically active. Okay? Nombor 3, tidak merokok. Nombor 4, tidak mengambil alkohol berlebihan. Dan nombor 5, having a normal BMI. Simple. Tapi kebanyakan major diseases in the world is actually caused by these 5 not being balanced. Right? Other things are like the berfikiran positif, skill of stress management, tidur dengan cukup, dan our interpersonal relationship. Okay, just go through apa itu pemakanan sihat. What is healthy eating? Is eating all the components within our requirement. Betul doktor, saya memang makan ikut komponen semua makan pun, tapi makan terlebih. Tak sihat ya. They're eating all the nutrient needed by our body within our requirement. Practice lah ni. Senang je kan? Active physical tu apa? Ada piramid juga ni. Apa benda setiap hari kita aktifkan diri kita. Contoh tempat kerja apa? Menggunakan tangga, berjalan ke kedai, berjalan ke pejabat, letak kenderaan lebih jauh. Dengar macam simple, buat and consistent, you will get the benefit. 5 hingga 6 kali seminggu, jalan laju sikit, pergi brisk walk. Kan? Kumpulkan sekurang-kurangnya 30 minit aktiviti fizikal. 2 hingga 3 kali seminggu pergi buat yang ni, yang ada weight sikit. Ya. Lepas tu kurangkan screen time. Simple. Ya, ini what is recommended by CDC. I just want to share because I think it is very practical and I've been using it on my patients. This is what a healthy activity looks like. Tengok dia, Sunday, Monday, Tuesday, 3 hari dia hanya buat 30 minutes brisk walk saja. 30 minit saja. Brisk walk je pun. And then Wednesday some weight training, and then Thursday, Friday brisk walk again, and Saturday weight training. Very easy to do. Ya, pergi mall, jalan laju sikit, you dah dapat dah. Siapa pergi mall 30 minutes? I think very likely 3 hours adalah. Kan? Macam tu. So 150 minutes of moderate intensity aerobic activity and 2 days muscle strengthening activities. Ya. Macam mana exercise reduce stress? Better sleep, a form of meditation, concentration, it will improve, and also the hormone endorphin. The endorphin hormones. Cumanya I have to warn all of you, sesiapa yang ada these diseases, please get a doctor's advice first whether you are safe to do moderate to high intensity exercise. Moderate to high intensity exercise ni apa? Yang our heart rate reach 140, 130 above. That is too high. Kalau dalam 100 is okay. Tu kita panggil dia low or moderate macam tu. Tapi kalau moderate to high, all this listed here need to get doctor's prescription first. Doctor's punya evaluation. Like having cancer, nervous system including stroke, metabolic system including uncontrolled diabetes, musculoskeletal system like knee pain, heart problems like having heart attack before, respiratory problem which is not controlled like asthma, or kidney disease which are chronic. Right? However, you can always start low and go slow. Jalan je dulu, tak payah laju pun. Dah rasa okay, 5-6 minggu baru up. Macam tu. Okay? Normal BMI, semua orang well-versed. Apa itu normal, tapi normal ke tak tu another question. Right? Of course, in weight loss, it is not as simple as saying it, but there are methods that are effective. Yeah, and the help is everywhere. We do have also here in our hospital, right? Not smoking, yeah, there is no halfway in terms of smoking, yeah. I've been a smoking cessation practitioner for quite some time now, so I've seen a lot of like reasons people, yeah. They will ask me, "Ala doctor, I don't smoke like before. I only smoke half and then I throw away." This is real story, bukan I cerita. He was in the process of stopping smoking. Dia try to negotiate dengan saya. Doktor, sebelum ni memang saya satu kotak pun, tapi sekarang saya smoke half tu saya buang. Saya smoke half tu buang. Well, for smoking there is no halfway. Because for normal cancer to turn, for normal cell to turn into cancer, dia ada gate. This gate is so different from individuals. Ya, itu sebab kenapa pakcik sebelah tu umur 90 lebih smoke 2 kotak okey je. Kita tak tahu gate dia macam mana. Dan kita tak tahu juga gate kita macam mana. Right? And then of course with WFH and quarantine nowadays, you have the first hand smoke, you smoke, second hand smoke, you smoke, children around you, third hand smoke, you smoke, room empty. But anak-anak masuk room still smell of smoke. That is a third hand smoke. Okay. Same as quit smoking, there are effective way to do it. Yeah, there is effective way to do it, and licensed medications that can help you. Alright, alcohol, for those who are drinking alcohol, what does it mean by not taking too much alcohol? Okay, too much alcohol is by female more than 1 unit a day. Apa satu unit? Size 2, tengok gambar ni. 1 beer, wine, like 3/4 glass, that is 1. So untuk men, more than 2 unit in a day. That is considered more. Extra or over. Or I don't drink every day, doctor. I only drink over the weekend. But then tengok, one sitting, if it's more than 5 minutes, means it is excessive. Okay, finally, what is mental toughness? What is the relationship of what we've been discussing before on mental toughness? Okay, so mental toughness ni dia ada banyak model. There are a lot of model explaining what is mental toughness, but from all of them, to me, this is the easiest to understand. Yeah, nampak complicated, but easiest to understand. So mental toughness ni, there are 4 components. It's about the control, our control of the situation, emotional control, our life control, or our commitment in achieving our goal, our challenge, challenge, our risk orientation, learning orientation, how challenging, how strong are we in facing challenges. And then confidence, how confident are we on our own abilities and our interpersonal confidence also. Because in world, we are living with others, we don't live alone. Yeah, you tak suka cakap dengan orang pun, you still kena bercommunication dengan orang juga. Okay, so ini contoh dia. Why is mental toughness important for attitude towards stress, pressure, crisis, and chaos? Each factor explains to what extent. Contoh, control. I am able to manage my emotion when under pressure and act rationally. Okay. I have a sense of self-control and I feel in enough control of my life for my life to succeed. I am in control. Kan bila orang ada stress sampainya dia akan give up. Dia kata, I cannot control this anymore. Okay. In terms of commitment, I am prepared to work very hard and do what it takes to succeed. I am not easily distracted. I set goals and targets for the important things in my life. So that is commitment. Challenge, I am open to change. Give it to me, baby. To new experience, to new opportunity, changes does not frighten me. I reflect and learn from everything I experience and see, even setbacks, and I'm focused on solutions, not the problem. Okay? Confidence, I have self-belief in my ability. I can do this. I can deal with whatever happens and will use those abilities. And I can influence and engage with others productively. That is what is relationship of mental toughness and stress. So what is the concept of MT, mental toughness? Mental toughness is a vital trait used very commonly in education, workplace, and military. Emotionally, it makes somebody have a greater level of control and confidence. Cognitively, exhibit a greater inhibition, which allows them to commit to current tasks, to the goal. Behavior in managing stress, more likely to adopt problem-focused coping strategies. I believe in myself. I believe I can fly. Make use of positive techniques. All right, so take home messages. Are we stressed? Okay, or what the effect of stress on your body? Itu tu. Okay, and then because of stress is something that we have acclimated through years and years, this is the recommendation for health screening by Kementerian Kesihatan Malaysia for the population of Malaysia. So first component is a cardiovascular risk, right? Checking your blood pressure, your blood glucose and all. And cancer in men will be the colon cancer, but see, mental health, depression is included as one of the things that we should screen during the health screening or get screened even. For female also, the cancer of cervical, breast and colon, but down there, depression or the mental health is something that we should be screened and we should look after as well. Alright, so in conclusion, this is from the KKM, menangani stres dengan bijak. What is stress? Tindak balas fizikal, badan dan emosi perasaan. Tindak balas is all within ourselves terhadap sebarang perubahan di sekeliling kita. Ya. Apa itu tanda-tanda stres? Kita dah belajar ni, right? Kenapa kita stres? The stressor, ya, the stressor. Lepas tu apa kita boleh buat? Jangka masa pendek kita guna 10B to break the cycle, and then kita guna ideal technique to actually solve the problem. Alright? So antara skill yang important ialah anger management, the traffic light. Alright, so with that, I thank all of you for listening. I will pass the floor back to our chairperson. Thank you very much.
Thank you, Doctor, for that. There have been a few questions study, so I'll bring it up, alright?
Yeah, sure.
Okay, so there's one person that asks is how to control the self when he or she is having bipolar anxiety, and sometimes they don't know what they do and they only realize it after things have happened.
All right. Bipolar is a disease. It's not a stress, right? So in managing bipolar, it is a psychosocial approach. It needs a multidisciplinary approach. All right. It is not this. It is not a DIY thing. All right. DIY thing can be used to manage stressor, but the bipolar has to be controlled by medications prescribed by psychiatrists. That is something different. Right, so this is not the DIY thing. But of course, this technique can be used when the bipolar is under control and there is a stressor there. So while dealing with the problems, or dealing with the stressor, of course, this can be used. But the actual treatment, this is not enough at all. Yeah, the diagnosis has to be properly done and the treatment has to be properly planned and then executed in a multidisciplinary team. All right.